welcome to this special live question and answer session. It's confirmed that you can hear me. Thank you for the like. Let's drop this one corner somewhere. Uso. Hello everyone. Thank you for joining in. Welcome to the live. Where are you watching from? Thank you for the like. This seems to be much. Let's drop it here. Drop it here. Welcome, Jeuso. Hope I got that. Pardon me, did I pronounce your name well? Jeuso. Let me push this back a bit. How are you today? Jeuso, can you hear me? Oh, okay, you can hear me. Great. I got the pronunciation. Please, where are you watching from? Where are you watching from? Where are you watching from? Okay, let's do it this way. Where are you watching from? Yes. Please, what flag is this? I'm not sure I can see this clearly. Is this the United States? No. What country flag is this, please? Jeuso, thank you, thank you, thank you. Yes, Jeuso, what country flag is this and what time is it in your country? So, welcoming everyone to this live. I welcome you especially. If you're just joining, let's know where you're watching from. Okay, it's 5:51. I'm trying to be sure. Is this flag? What country is this? I'm trying to check this. What country is it? Jeuso? 5:51. 5:51 a.m. p.m. So welcome everyone. Thank you for joining in. Where are you watching from? Where are you watching from? And what time is it in your location? Thank you for the likes. So one of the things I have come to know about people, individuals, patients, is the fact that some people don't actually find it easy, let me use the word, permit me to use the word, find it easy to interact with their doctor, especially if they are meeting that doctor for the first time. Okay. And it's important to know how to relate with your doctor. Communication is key and it's very important. You need to pass the necessary information to your doctor, and your doctor needs to understand what whatever it is that brings you to the consulting room, and that way he or she will be able to help you better compared to if he or she is not able to access information from you. So where are you watching from, and what time is it in your location? Jeosu, Jeosu, are you an adult, or because I know even though adults play games too, but most of the time children do more of Roblox, I think. Okay, so thank you, Jeosu. You've not confirmed your location. Where are you watching from, Jeosu? Where are you watching from? Adjust my video. And this is better. All right, so being expressive is very important when it comes to getting the necessary care that you deserve or that you desire when you are seeking for healthcare services. So if you are going to get the best, you should be expressive as much as possible. So let me know if you have any question. Sometimes some of these questions may be personal, and so it's always good to be able to interact well with your doctor. But other times, maybe general questions may not even be related to your own personal experience, but maybe you have question relating to something that you have come to find out about a friend, a relative, may need some clarifications on such. And as much as possible, I will be able to help to provide some basic information on that. All right, so it's time for questions. Time for questions from you. Eh, hello, Chef Jamie. Hello, Mom. Good to see you. Welcome to the live. Welcome, Chef Jamie. It's good to have you here. Happy Sunday. How was service today? And how are you and the family? It's good to have you, Chef Jamie. Welcome, welcome, welcome. Good to see you. Yes. Okay, Jay Uso. He said, "What's your day going?" Great. My day is going great. It's already night here in Nigeria. All right. So I've had a wonderful day. Very active one. Yes, thank you, Chef Jamie. Saying happy birthday to you. May God bless you and preserve you. Amen. Thank you so much. A wonderful chef. We all doing good. Thank you for asking. Yes. Thank God for that. Don't mind my voice. Seems to be a bit on the low side. I hope it's fine. I hope my audio is good. Jeusu says, "What's the difference between us and the best of your friend?" The difference is between you or us and the best of my friend. The difference is the big one. Okay, I don't know what area in the difference you're asking about. Okay, but really, we have different levels of relationships, and we have acquaintances, we have friends, we have family. So in fact, there are some friends that have turned to families, and you know, it all depends on experiences. You are live this late. Well done. We can hear you. Okay. Yes. Just sometimes you have this willingness, but the energy is not there. There are other times that the energy is just there, and as a content creator, I'm sure you know when you have the energy, and it's always good to maximize that. Even though my voice seems to be a bit cold, let me know. Let me know if there's anything you notice about my voice. All right, but I'm sure you can hear me clearly. Yes, J also says, okay, Jeff Jemmy says that's right. Thank you, Jeff Jemmy. Okay, I like Jay also is asking questions. So let me respond a bit to the difference, one major difference between us. Okay, maybe you and I have not met you before. I don't know you. So, but I'm just getting to know you now, Jeusu. And when you say the best of a friend, so friendship is actually developed over time. True friendship, real friendship is developed over time. And, you know, it takes some level of testing and trusting also. Testing and trusting experiences. Some of the testings may not necessarily be intentional. You know, they are born out of relating. So relating and then seeing how each person responds, how an individual acts. These are some of the things that go on in relationships, in friendships, and then each person now decides whether I'm okay with this kind of character or not. So the difference is really in terms of the time of getting to know each other, the experiences that we get to have, in the relationship. So that makes a lot of difference. There are people that I already have known for years. There are people that the bond is, strong. Of course, you cannot, you cannot, let's say, term I want to use. You cannot compare, you know, some relationships to some relationships. For example, relationship of a husband to wife. So I have my wife as my friend, very close friend. So if you're talking about the difference, so you can see that that's one major difference. And I've talked about the physical side, but on the other side, I talk about my relationship with God. Even though it looks like, where is God? Where is God? But God is in my heart. God is with me. I experience Him. I enjoy Him. So that's and He's supreme. He's sovereign. So it's one major difference. One other difference that I can tell you when it comes to friendships. So there's no closer friends. There's a song that says, "What a friend we have in Jesus." That's a powerful song. And really, we have a friend in Him. Happy birthday to you. Thank you, Jeff Jeremy. May God bless you and preserve you. Amen. Yes, all doing good. Good to know that you are all doing good. Thank you for the third like. So, what are the best things for me? The best things for me are the things that have to do with God and understanding of God's will for man. For example, God has said in His Word that above all things, that's according to 3 John 2, which is above all things that we prosper and be in health, even as our soul prospers. So that's one thing for me. The Word of God, the plan, the purpose, and the expectations of God, the will of God. These are best things. These are things I treasure. Okay, I value knowledge, so I seek knowledge. I like to, I'm creative, so I like to learn. So these are very important things for me. Okay, I value friendships. I like happy and excited people. Okay, so that's one. Those are some of the things that are good for me. Jeff Jamie says, I totally understand. Oh, hope I'm not lagging. Okay, Jeff Jamie says, that's true. I think the mic, I think the mic is helping greatly. Wow. Oh, thank you. So this mic is helping. Good to know. Thank you, Jeff Jamie. You also, thank you for your feedback. Thank you for the questions. But you've not told me where you are watching from. What flag is that? It's something I have not seen clearly. Just let me know. Let's know in the chat where exactly are you watching from. So I'm taking more questions. If you have a question, maybe health related as much as possible. But there are other questions that you may ask. If I'm able to answer or respond to that, I will do that appropriately. Thank you. How does this look without the lights? Now it's dark. Now it's light. Okay. I think it's better this way, right? So, as I was saying, the importance of communication in anything, in fact, in any relationship, whether in the relationship between patient and his or her doctor, it's a very important relationship. And you must learn how to relate appropriately to maximize that relationship. All right. Where are you watching from? Most of the time there. Jeusu, are you still there? Let me know in the chat. Are you still there? Chef Jamie. Hey, I'm Doris. I'm Doris Adogu. Good to have you here. Welcome to the live. Thank you for joining in. I hope you can hear me. Welcome to the live. Welcome. Thank you for joining in. Where are you watching from? Where are you watching from? Remember to like this live. Double tap on your screen to like the live. Oh, okay. Imo State. Wow, thank you. How was your day? Did you attend church? How are you doing? Are you a content creator on YouTube? Do you create videos on YouTube? Are you subscribed to the channel? Or you're coming across the channel for the first time? Please let me know. Where are you watching from? Welcome everyone who is just joining in. Let's know where you're watching from. Thank you for tuning in. And if you have any question, health related, please confirm in the chat. You can just drop your question in the chat. Okay. So you're a content creator, right? What's your niche? What do you do? What's the content on YouTube? So what kind of content do you create, Madam Doris? Welcome to the live. Thank you for joining in. Where are you watching from? What's the time there? Remember to like the live. Just double tap on your screen. I'm sure that will help to push this live to more people. And if you are yet to subscribe, please subscribe to the channel. It's a wonderful community of health enthusiasts. Yes, it's past 11 p.m. Right. That's West African time. So we are in the same region. So where are you watching from? For others who are just joining in, where are you watching from? What time is it in your location? And if you have any question, kindly drop in the chat. Okay, very good. Saying what type of question? Health related questions. Basic, basically. Okay, I like that. Now the topic is related to doctor patient relationship. Okay. I said in the introduction that there are a number of patients who do not know how to express themselves when they are in front of the doctor. Okay, but the fact is that not maximizing the time or the relationship can affect or influence in negative ways the 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 substance, yes, the substance of what they should get from interacting with their physician. Okay, so why do people have this challenge or challenges of relating with their doctor? Okay, some people are not that expressive, some people are afraid, they think doctor is going to chastise them. Some people feel that some doctors are not willing to listen. They are just there to write tests, investigations to be done, and maybe medications to be taken. Okay, so what are your thoughts about this? Doctor patient doctor relationship or doctor patient relationship? So, are there things that you think may be a challenge or challenges that individuals find when it comes to relating with their doctor? And how can we deal with this? How can we overcome? Very important, overcome these challenges. So for me, there is that aspect of personality issues. People have different temperaments, different personalities, and with this, individuals also bring that to fall to expression when they are relating with their doctor. Okay, but my emphasis is on the need to know what needs to be done for you to get the best possible when interacting with your doctor. So your confidence must be in place. You must be confident in yourself. You must be confident in the person you are relating with. Okay, you cannot be going to seek care with a doctor or in a health facility that you are not confident in. Okay, let's shut your power here now. So I'm going to switch. I'll be with you soon. Okay, so you cannot continue to relate, you cannot be confident to relate with a facility or physician that you are not confident about. So if you are going to get the best, you must have it of trust, and that will help you to also express yourself better. But if you do not have confidence in the physician or the facility, then you cannot get the best from that facility, even if they have the best. So you must look within as an individual. What are the things? What makes you not to be expressive when it comes to interacting with your doctor? So is it something within? Is it something that you need to deal with personally? Is it something you need to deal with personally? Is it something that you need to even clarify when it comes to communicating with your physician or as a matter of necessity, the the people in charge of that particular facility. So that's one area that must be checked. So irrespective of your temperament, your personality, you need to get the best from that interaction, that relationship. Okay. And there's nothing wrong in making changes. If you need to change your physician, if you need to change the facility you use, why not? If you're not getting the best there. Okay, but you must check yourself first of all and be sure that you are positioned correctly, you have the right heart, you have the right attitude in seeking healthcare. So in terms of relationship between patients and doctors in Nigeria, okay, it's very poor. Doris is saying that the doctor found it difficult to answer patients and answer them in good manner. This needs to be addressed. You're very correct, Um, it still boils down to personality, individual characters and personalities. So if we have patients that lack confidence, we also have doctors that lack confidence. We have, apart from patients that have personality issues, we also have doctors that have personality issues. So the matter of communication, the matter of a doctor responding appropriately or answering a, a patient's question, clarifications being made, necessary to be made for a patient is an obligation. It is expected. That is why the two are getting to connect in the first place, because there is supposed to be a communication. So if that physician is not doing the needful, then they are cheating, cheating the patient. Okay, so there should be value for your time. There should be value for your money. Okay, so like I said, it's definitely possible to switch, even if you feel that you are not satisfied with the service or services you are receiving from a particular setting or setup. You can always change. All right. So, but before you do, there are ways that you can address this. You can communicate appropriately with those in charge, whether they're a customer service person or persons, and see how some changes can be made. Okay, so you are right. We have this complaint from patients, sometimes talking about how they tried to communicate, express themselves to a particular doctor, and they were not getting the necessary response or responses. Okay, but there are times that um, sometimes some patients are actually seeking more time, attention than expected. Okay, some people don't even know. I have this interesting experience that some people, while waiting to see their doctor, they are out there complaining about the time, the delays and all, which should be checked. But some people don't understand the fact that uh, individuals are different. The people have different complaints at different times. People have different ways they communicate and expectations. So if an individual spends a certain time with a doctor, another patient outside waiting to be seen may see it as I'm being delayed. you know That's where communication comes in. So such patients should receive appropriate communication on why the timing is such. Of course, there should be guidelines, protocols when it comes to management of time. It's depending on the facility or the individual uh, consulting with the physician. Okay, but it is important to note that diagnosis or complaint symptoms will differ, diagnosis will differ, management will differ. So this understanding is very important. So if there is a commitment on the part of the physician to explaining or answering questions being asked by a patient, of course the patient will feel satisfied. But the doctor is also thinking about other people out there. So as much as this is something that has to do with skill, and the skillfulness comes with experience. It comes with people, doctor experience, and having different approaches or strategies to dealing with that particular area when it comes to doctor patient relationship. Okay, so the question on what should be the solution, and I'm calling attention to the fact that individuals have responsibilities, have to make decisions, you have to make corrections, you have to make necessary changes, whether you are a doctor or you are a patient. So this understanding is very important. So some people don't have it. That's why they tend to have a perception, a mindset about a particular doctor, a particular facility. But communication will go a long way to deal with the uncertainties, the areas that are not clear. So that's a major part. Individuals need to communicate, whether you are a patient or you are a doctor. Okay, so you should also be able to, as part of expressing yourself and your confidence, you should be able to ask your doctor questions. Even if your doctor is refusing to answer, you should ask, okay, doctor, why are you not giving me explanations for this? And if the doctor is not doing that appropriately, of course, you have the customer service manager, you have the public relation officer for the hospital. You can communicate appropriately with the appropriate office, and necessary correction can be made. Okay, so but there can't really be that achievement of the purpose for interacting as doctor to patient if this point is not understood and is not taken as important as it is. So this is a very important aspect of the doctor patient relationship. Okay. So in terms of relationship between patients and doctors in Nigeria, it's very poor. Yes, we get a lot of complaints, especially on social media, complaining about doctors. The interesting thing is that these are really few cases compared to many impacts that doctors are making, and many influences, many people that doctors are putting smiles on their faces. Okay, all right. So there are doctors that still answer patients' questions, and I'm one of them. I try to clarify for patients, try to help them educate and help to understand, for example, what symptoms they are having, why the diagnosis, the necessary examination, the necessary investigations, and then the plan for treatment. Um, Part of the treatment is specific medications that they are to take, how they are to take it. So that's one very important aspect when it comes to achieving good health, optimum health. It begins with that interaction. Okay, if we get it right in that area, I'm sure a lot of people will get to enjoy more healthcare services, even in the country. Thank you for the likes. Thank you for the thumbs up. Thank you if you are just joining in and you are watching. Let's know where you're watching from. Okay, I'll say you are listening now. Okay, let me know where you are listening from. What time is it in your location? So if you have any question, kindly drop in the chat. So we've been talking about doctor-patient relationship, how it's important to be expressive, whether as a patient, as a doctor, because that's one way, major, very important way to understand and achieve proper healthcare. Okay, let's try to get some lighting now. Oh, welcome back. Hope you can hear me. I believe you can see me now. Okay. Please confirm that you can hear me. Jeff Jamie, Doris. Okay, thank you for the likes. I hope I can get to see your chats now. Yes, thank God I can see. Oh, okay. Doris, are you still there? Please, still on that question on what should be the solution. So we started by talking about individual commitment and changes that need to be made to maximize the relationship between the doctor and the patient. Also, I need to talk about, we must find out why. We've talked about individual challenges when it comes to doctor responding to patients' questions. Okay, but we should look at the pressure, especially depending on your environment. Okay, if you are in Nigeria, for example, You can, if you, I don't know if you know the ratio of a doctor to patient. I'm talking about thousands. So if the pressure of the load in terms of number of patients to be seen, some doctors cannot handle that pressure. I mean, to an extent, the doctor will be able to do, but depending on the facility, depending on the center, depending on where you are seeking for healthcare service, you will find out that if you have a crowd, if you have a very densely populated facility, you can be sure that there will be pressure, and that can reflect in the way, maybe shouldn't be, but it may reflect in the way, especially also in the time that the doctor wants to spend with you. Okay, because there are so many other patients that are waiting. So if you see it as, oh, I'm the only one here, doctor needs to pay attention to me. No, doctor is thinking about other people. So I say it this way, that some people come in, initially coming in angry that they've had some delays in seeing the doctor. By that time they come in, they also try to spend more time than expected, you know, and that affects others who are to come in to see the doctor. So you can see how it plays. That this is not just a one-sided approach that we need to have. There are many sides to it. So that means such facilities, places where they are being overwhelmed, should be looked at, and necessary approach or changes should be made to ensuring that this is dealt with. Of course, this may involve employing more doctors. Okay, employing more doctors. That's interesting, because we know about the Japa syndrome. People are leaving the country in numbers. If you are in Nigeria, okay, but that means the government, employers of labor should have measures to ensure that the pressure on their staff is reduced as much as possible. Okay, there needs to be some form of encouragement for even people that are coming in fresh as doctors, be encouraged to even spend time in the country to support the system. Okay, so that's another way to look at it. Okay, apart from the individual characteristics that may affect how a doctor relates with a patient. Okay, there are general challenges which we most of us know. If you are in Nigeria, and if you are in any other country, you know the peculiarity of your country. Okay, so that's another thing. Okay, so let me know if you still have questions. No questions. Welcome to the live. If you're just joining in, let's know where you are watching from. Where are you watching from? Remember to double tap on your screen to like the live. Doris Adalgo, hope you got some points from what I've shared in response to your question. Welcome, Escano. How are you today? Where are you watching from? Escano, introducing yourself so big and deeply. So, where are you watching from, Escano? And what time is it there? Where are you watching from? Remember to double tap on your screen to like this live. Oh, okay. Escano is a name character. Okay. Okay, by the way, if you're German, okay. Welcome. Are you currently in Germany? Are you German living in Germany or somewhere outside Germany? Welcome to the live. Let's know who is watching. Where are you watching from? What time is it in your location? Oh, Escano says I can speak German if you want. Okay, let's speak English. Oh, you live in Germany, right? Oh, that's good to know. It's good to know. So we're talking about health, questions relating to health, and time for answers to such questions. Excuse me. Now you need to interpret what you have typed there, right? Escano. Hope you can translate this now. What have you typed in there? Give us the interpretation of your language, okay? Waiting, 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 waiting. Welcome to the live. Where are you watching from? And what's the time in your location? Okay, so it's interesting talking about experiences relating to doctor and the patient. Waiting Escanor, waiting. Ja, lip, dum, waiting for the interpretation. Right, so in a few minutes we shall be closing this session. So thank you for engaging, Doris, Jeff Jamie, the Uso, and of course Escanor. Oh, okay, the Uso. Still here or you back? Seems you left earlier, you're back now. Welcome back, Jeuso. Thank you, thank you, thank you. Thank you, Jeuso. Not to worry. How are you doing? Thank you, Jeuso. Welcome everyone to the live. If you're just joining in, let's know where you're watching from. Few minutes more, we will be closing this session. So thank you all for engaging. Okay, from Nigeria, Jeuso, this Nigeria. Okay, so I'm sure by God's grace we will be catching up again. So have a great time, whatever time it is in your location. Pleasant morning, good afternoon, and wonderful evening. I'll see you again soon. Bye for now. Bye.